Today, I want to tell you about two procedures that you may not think about that are the perfect pair, and that is orbital rim reduction and a brow lift. I'm Dr. Sarah Saxon, double board certified facial plastic surgeon, and in this video, I want to explain why orbital rim reduction and brow lift go hand in hand for the best results in the upper part of the face. What made me think about doing this video is that if you have been in my office, Wendy, she is our aesthetic concierge, so she's with me for all of our consults. She's on the phone with all of our patients. A lot of patients know her really well. Last January, it's been about 9 months ago, we did a full face rejuvenation for her, which means a brow lift, a lip lift, face lift, neck lift. We did some fat injection, a little skin pinch, lower blepharoplasty. She's had an upper blepharoplasty before, and the one thing, she has amazing results, but the one thing that's now still bothering her is she realized now that what was hooding over her eyes was her orbital rim. And now she really wished that she would have done that. And we talk about it all the time, and we'll probably go back and do that part of the procedure. But because she is so bothered by it in the past, it's been really difficult for women to be open to the idea of doing bone contouring in this area, but it's becoming more and more common now. And so I tend to want to point that out for a lot of my patients now that may have not thought about it before. And it can be a little shocking at first. So I wanted to explain what the orbital rim reduction entails and why it's a perfect pair to a brow lift if you're already getting a brow lift procedure and your anatomy warrants that. So what are feminine versus masculine features? Many of you know I do facial feminization surgery, and the upper third of the face is the most important for distinguishing masculine versus feminine features. So you can have a wide jaw, you can have a big nose, you can have some features that kind of age you a little bit, but if you have a prominent brow ridge and low set eyebrows, that is very masculinizing more than anything else on the face. I trained with Dr. Jeff Spiegel. He did a lot of these studies that prove this fact, and because I know this, I can prioritize some procedures for some patients over others. Now, for women that have very prominent orbital rims, it doesn't matter how much you lift the brows, they're still going to look a little masculine. And so leaving that one part out makes a big difference in facial rejuvenation procedures. I've seen some patients of mine that just have overall more masculine features. Their personal heritage may contribute to that. They may have a higher testosterone level. For a number of reasons, women can have a prominent brow ridge. And like I said, no matter what I do with like fat injection or blepharoplasty or brow lift, it will not address a hooding over the eyes and create a better aesthetic result without addressing the bone. Now, one thing that people don't realize is that aging actually causes the face to look more masculine. And that's because masculine faces have smaller, more deep set eyes and a more wide square jawline. But as you age, the skin loses collagen and elastin, so it makes your eyes look smaller as your brows start to descend. And also the face and fat pads start to descend as well. So even if you had a more V-shaped lower face, it starts to look more square as you get older, and even your chin starts to look more square. The upper lip starts to elongate as well. And so anything I do as far as facial rejuvenation or making the face look younger is also facial feminization surgery, and most people don't really understand that. If I'm doing orbital rim reduction for facial rejuvenation, what does that actually mean? So when I am doing a brow lift, I tend to want to be a little bit more comprehensive in my approach. Similar to a deep plane facelift, I like to do a deep plane brow lift and not only lift up, but also rotate the brows medially, like towards the center. To do that, I need appropriate access, and I don't want to make the hairline higher. So I tend to make a pretracheal incision right in the hairline. I can get a better lift than an endoscopic approach. And that incision also gives me access to the orbital rim. I'm already there. It doesn't add too much more time. I still have to close the same incision. The main difference is while this is exposed and I've released all the ligaments to lift the brows, I can use a special tool called a bone resurfacing tool to contour the prominent areas of bone on the side and make the eye socket look a little bit bigger. I can also, sometimes with a little bit of atrophy of the temporalis muscle in that area, I can contour the bone right along the temporal line where that muscle inserts to create a less hollow look. That makes a huge difference, even if I'm not doing a full brow bone reduction where I set back the bone. In that case, I use titanium plates and screws. And still, with plenty of women, I do that technique, but some don't have prominence in this area. It's just on the side. And those are the women that need orbital rim reduction. It basically takes me about 10 minutes more than doing a traditional pretracheal brow lift. It can add a little bit more swelling around the eyes, but if I'm doing any bone work in the upper face, I give you a steroid taper to help with that and then have you ice your eyes. It really doesn't add much in the way of any kind of downtime. And so it is a perfect time to do orbital rim reduction if we're already in there doing a brow lift. Now, I'm finding that it's becoming more and more common for women to come to me specifically for brow bone reduction and orbital rim reduction. And why is that? Facial feminization techniques have become a little bit more mainstream in the last few years. And now that people know that it exists, there aren't very many people that are trained to do these procedures. Seeing as how I do facial rejuvenation and facial feminization, it's the perfect combination in the perfect time for people to really be aware of what their options are and how to get the best results possible. So I see women from all over the country who come to me for these combinations. It's not something that I just do periodically. It's something that I do on a weekly basis. For anyone doing these techniques, you want someone that's very experienced in doing either facial feminization or have particular training in doing orbital rim and brow bone reduction procedures. So I hope this video really helps clear up any questions you might have had. Of course, if you have any further questions, leave a comment below. I answer those questions quite frequently. You can also give our office a call if you want to schedule a consult with me at 512-537-4191. I have lots of information on our website and our blogs about brow bone reduction and orbital rim reduction, so that could be very helpful for you. But don't forget to subscribe to the channel. I'll be putting more and more content out about this particular topic. And so I look forward to hearing from you soon.